I'm Dr. Tahira and you're watching program Health is Wealth. Last week we spoke about the bride's health. This week we're speaking about the groom's health. Because of wedding season, we thought why not talk about infertility in detail and all men health problems, because in cases of marriage what happens is the daughter-in-law and the wife is always blamed without ever looking into one's own health. So let us today in detail discuss male urology. Assalamu alaikum, welcome to another episode of Health is Wealth. Last week we spoke about women's health and we were talking about the bride, and this time because it's wedding season we are going to talk about the groom and the groom's health. Along with the groom's health we will also be discussing men urinary problems as well as female urinary and kidney related problems in detail today. Today we have with us a urologist. Thank you so much Dr. Farrukh Abbas Awan for joining us. He's a urologist and he's practicing and he's going to tell us in detail everything that we need to know about our kidneys, about our ureters, urinary bladder, everything to do with the male reproductive system as well. Thank you, sir. Thank you so much for joining us.
Bismillahirrahmanirrahim. Thank you very much, Dr. Tahira, for inviting me in this program. And definitely I would be talking about all these topics. I am consultant urologist and infertility specialist.
Thank you. So let us begin with infertility first, because you know there are a lot of weddings nowadays.
Exactly.
And a lot of people have this fear of being able to get married or not, and even after they get married they have problems of infertility, and then they keep taking their wife or their daughter-in-law to the doctors and they keep getting injections and treatments without ever the man going to the doctor. So could you please tell all the reasons for male infertility and how important it is that they take the male and female both to the doctor to get evaluated?
Exactly. This is a major subject and it is developing problem these days. Most of the time men are shy to visit a doctor or urologist regarding their related issues, and mostly they are only blaming the female for being infertile and those things, although it is 50% contributory factor from both male as well as female side. So the patient should be confident enough to visit a urologist and discuss their related issues and get it treated.
Okay, there is another also trend that because these topics are very sensational and they trend easily, there are a lot of people out there who claim to be sex specialists, who are just psychologists and nothing else, and not even psychologists, and they are they're getting very viral and talking about it. Can you please tell people that no, it is important to visit a proper licensed qualified urologist for this subject, not anybody who calls themselves a therapist?
Yeah, exactly. Basically this is a subject of a urologist and in further subspecialties andrologist.
Yes.
And we are the people who are properly diagnosing and treating these issues. Instead of visiting any other doctor, they should properly visit a urologist and andrologist for these
Exactly.
matters.
Can you please tell us some of the main reasons of infertility in male, so that people know that taking these random kushtas and drugs that are available, these pills and anywhere and everyone, people are prescribing, and people start taking these different kind of totkas from here and there. Could you please tell what are the main reasons of male infertility?
Yeah, so let's detail these matters. That first of all, there are different things, different diseases which are included in this male infertility issues. One thing is infertility, that person is not able to reproduce a children. This is a reproductive issue. Another thing is related to the performance. There is premature ejaculation and erectile dysfunction. So if we talk about the infertility, basically, so a person who is unable to reproduce after unprotected intercourse for more than 1 year, he should be labeled as patient of infertility. And accordingly we start with the physical examination of the person. We have to examine him properly, and then we have to do certain investigations including his hormone tests, his semen analysis, ultrasound of the scrotum, etc. And whatever is the matter, we have to treat it accordingly. Suppose if there is a contributory factor which is a varicocele. Varicocele is a dilatation of the veins inside the scrotum. Because of that varicocele, the temperature of the scrotum and the testis is raised, and the quality of semen is not normal. After that, there could be loss of motility of the sperms, and it could also be contributory factor to the count of the semen.
Okay.
So we have to investigate all these things. If count is less, if motility of the sperm is affected, we have to treat those matters. And if varicocele is a contributory factor, it needs a proper surgery for that is varicocelectomy, to cut off these dilated veins to
So
treat
what are the
matter.
symptoms of varicocele? Do you see it in young children also, growing boys? How do we know that somebody has varicocele?
Well, usually it is a disease of adolescents, and it is just a dilatation of the veins around the testes. And patient can have symptoms where he might feel dragging sensation, there is discomfort in the scrotum and heaviness and swelling sometime. So after these development of symptoms, he would visit our doctor, and after examination and with the help of ultrasound, we can stage or the grade of the varicocele. And accordingly, if it is a smaller size and less grade, or then we treat it conservatively, but if it is of higher grade, we have to treat it with
So does
surgical
injury
management.
to the scrotum or injury to the testes also play a role, like people who have had an accident in the past, can they also become infertile?
Well, it is not exactly that contributory factor, because of trauma there might be ruptured testes, and its structure is damaged. After that, testes might not be able to produce the sperm, but usually trauma is less.
You said hormonal causes. So what are the causes of low testosterone, and how do we know that some man is suffering from low testosterone? And are there options available like testosterone injections or supplements so that they can get better?
Yeah, exactly. We have to investigate the matter. If the serum testosterone level is low, then we have to check whether it is being produced in lower quantity or there is any other factor. And usually testosterone supplement is being practiced, but it is not advisable. We have other hormonal supplements which we can give to a person, and naturally the testosterone would be raised.
So
with
what would you name them as, like this arginine and you know this
there is L-arginine
and DHEA,
zinc, and there is
citrulline something, right?
these are selenium, zinc, vitamin E, and these.
What about
contributing
things like
factors.
these herbs called ginseng and
Yeah,
this
of
salajit
course.
and all of that?
Yeah.
Are they useful?
There are certain tablets in which these elements are also included. These are natural herbal elements, and with the use of prolonged use, you can say they are contributing well to the matter and
So
increasing the semen quality.
So you said this is for the hormones. What about you said that the semen can be, you know, there can be oligospermia or azoospermia and all of that, right?
Yeah, exactly.
So is there a way to improve that?
Yeah, they contribute to all these factors up to some extent. But if there is mechanical cause, like if there is varicocele, we have to do surgery for that. Varicocelectomy.
But
is
if
the
somebody
surgery.
has, for example, azoospermia, or that means that there is no sperm count, viable sperm count in their semen, then is there a way to actually fix that or no?
Yeah, exactly. Azoospermia means that there is nil count. There is no sperm present in the semen.
Right.
So we have to find out the cause. Either it is not being produced, or the other condition is that sperm is being produced, but the tubules which are transporting the sperm from testes up to the external meatus, they are sometimes blocked.
Okay.
Vas deferens and ejaculatory ducts, if they are blocked. So we have to investigate. We can do biopsy of the testes and find out that if there is sperm present in that biopsy, means it is being produced.
Okay.
And then we have to find out the cause and the level of obstruction. If obstruction is the cause, then there is a surgery to excise the blocked part of the tubules and reanastomose them.
Okay.
But if in the biopsy there is no sperm present in the testes, then it is a red flag.
Okay. What about erectile dysfunction and premature ejaculation?
Yeah.
What they call impotence in in layman's terms. So what is that?
Exactly. These are two different things: erectile dysfunction and premature ejaculation. It is very, very common and increasing in this era. And so let's talk about erectile dysfunction. It means that a person is not able to achieve proper erection and able to penetrate and do the intercourse. So mostly in the young age, it is psychological effect. Like if patient is in anxiety, depression or stress, then this might be a cause of erectile dysfunction. So we have to dig out the cause and treat it accordingly.
Right.
Similarly, premature ejaculation is mostly also psychological and anxiety related. So we have to give them sometime antidepressants, anxiolytics and certain other medications which would improve the symptoms.
What about circulatory causes? Because they say that a compromised blood supply can also cause
Yeah,
it, and
exactly.
vasodilators help with it. So all these circulatory causes, high blood pressure, or taking drugs for high blood pressure or heart disease drugs and everything, do they also play a role?
Yeah, exactly. Very nice question. So basically, I told about a young generation, young
Okay.
population. In the old people and especially the diabetics, the vascularity is definitely reduced with the passage of time because of vasculopathy, diabetes induced vasculopathy. The lumen of the vessels is reduced and it contributes to the erectile dysfunction, especially in old people. So in those cases, we have to take help of different vasodilator medications like Cialis, Viagra, Levitra. These are medications which could be prescribed if there is organic cause.
And what about
if-
neurogenic causes? For example, the spinal cord or compression of some nerves.
Yeah,
also,
in those
and trauma.
cases, if it is a neurogenic cause, usually we cannot help them much because if spinal cord injury or any other injury at the level of nerves, then they might not be able to achieve erection. But in those patients, there are new techniques and new modalities in which we install the prosthesis in the penile shaft, so that with the help of those silicone rods or inflatable devices, they are able to achieve the erection.
Okay, so when we talk about these are all the causes of infertility, what kind of diet or exercise or weight control would you advise to everybody? And especially, you know, a lot of children nowadays, they go to the gym and then they start having these anabolic steroid supplements, which are very harmful for fertility.
Exactly.
Can you talk about the harmful effects of these anabolic steroids and bodybuilding, and then advise what is the ideal weight and diet and supplements that they should be taking?
Okay, so exactly, obesity contributes negatively towards these male fertility factors. So weight reduction, exercise, balanced diet, especially the vegetables and fruits, these diets are very much helpful and better for male fertility and these erectile related dysfunctions. And the anabolic steroid, they are definitely contributing very negatively to male sexual health, and they reduce the testosterone level. So if testosterone is reduced, all these mechanisms would be disturbed and there would be loss of libido, erectile dysfunction and all these factors. So they are definitely harmful.
Thank you so much. Now let us shift to the prostate. A lot of men after the age of 45-50, they suffer from prostate, right?
Exactly.
So what exactly is the prostate gland? Why is it enlarged? What is benign prostatic hypertrophy? How do we, suspect it? What are the things we need to do about it?
Yeah, exactly. So let's talk about prostate. Prostate is a male reproductive organ which is part of the male reproductive system. It is present around the urethra, and it enlarges with the age. It is just like an aging process. With the passage of time, it starts getting enlarged, and when it is enlarged enough that it would start compressing the urethra, so a male patient will develop the urinary symptoms. So usually the urinary symptoms is increased urinary frequency, urgency, nocturia, weak urinary stream, intermittency. Person has to strain or push a lot to pass out the urine, and incomplete bladder emptying. These are usually symptoms with which patient presents. So we have to find out the cause. Usually after the age of 45, it starts enlarging, and normal size of prostate in a male is around 18 to 20 grams. But when it starts increasing in size, like 25 to 30 grams, these symptoms develop. And usually in the beginning, we try to control these symptoms with the help of medications, alpha blockers, and with the help of combination of medications if it is more enlarged, or either not responding to simple medications. So we start with simple one medicine and then combination of medicines. If it's still not helpful, we have to do surgery for the
This
prostate.
TURP, the resection of prostate, how big of a surgery is it? And
Yeah, transurethral resection of prostate is basically a endourological procedure in which there is no cut or incision. With the help of a cystoscope, which is our camera, we go inside and look at the size of the prostate and the anatomy, and accordingly we decide that how much resection should be done. And there are three lobes of prostate, basically two are the lateral lobes and one is the median lobe. Median lobe is projecting inside the urinary bladder and it acts like a valve while urination, and it is a major contributory factor to the blockage. Even if the size of prostate is not much larger, but there is a median lobe, it acts like a valve and it closes the outflow pathway. So we have to do the transurethral resection of prostate. It is a major surgery. Patient has to undergo either spinal anesthesia or general anesthesia, and it takes about 1 hour to resect the part which is blocking the outflow. Either it is median lobe or lateral lobes. We have to cut the chips and remove them with the help of our Alic evacuator.
But this is about BPH, right? But a lot of doctors also test for prostate specific antigen and then they say it could be a prostatic cancer.
Yeah.
So the same modality of treatment as for prostatic cancer also, or
No,
is it different?
basically TURP we do for benign prostatic hyperplasia. After resection, we have to send this tissue for histopathology and wait for the report. But if it is very enlarged, much enlarged prostate and old age patient, and there is family history of prostate cancer, then we must do certain investigations like serum PSA level, and we can do the transrectal biopsy of that prostate, or these days we prefer MRI, which will give us about information about the anatomy of the prostate and its extent, either it is localized or locally extending, or it is metastatic. We get all information and accordingly we treat the patient. If it is a case of prostatic cancer, then it is definitely a different modality and different treatment options. We usually don't do TURP. Until and unless there is complete blockage of urine, the patient is unable to pass, then we sometimes make a channel, which is called channel prostatectomy, and we have to reduce or stop the production of testosterone, which is major contributory factor in the development and progression of prostate cancer. So for those, there are different options, either to remove the testis or orchidectomy, or there are certain medications or injections and which are reducing the testosterone level.
So when we talk about these symptoms where you said, you know, increased frequency of urine, and then you said stoppage of urine while coming, what if there is burning as well and we suspect UTI? So let us talk in detail about urinary tract infection, and not just in males but very common in females also, and some female recurrently they keep having. So what is exactly UTI? How do you investigate it? How do you prevent it? And how do you go about it?
Okay. So if we talk about urinary tract infection, so mostly a contributory factor to development of urinary tract infection is incomplete bladder emptying due to any reason. Like in male patient, if it is enlarged prostate or any other blockage in the urinary tract, in the urethra, it will contribute to the incomplete bladder emptying. So whenever there is incomplete bladder emptying, it would help in the bacteria to grow, because in the pool, which is a residual urine, is the major contributory factor. In the residual urine, there would be a development and growth of bacteria leading to urinary tract infection. So there is a term called recurrent urinary tract infection. So recurrent UTI is basically if there are more than 3 episodes of UTI per year. So then we label it as a recurrent urinary tract infection. So we take help of ultrasound, which is pre-void and post-void residual urine. First patient will undergo ultrasound with a full bladder, and after that he is instructed to go to washroom and void. And after voiding, again ultrasound bladder is repeated to see that how much is the residual urine. If residual urine is more than 50 ml, so we consider it as a significant, and we have to find out the cause of this incomplete bladder emptying. In male, it could be prostatic enlargement, it could be urethral stricture. In female, there is very much common problem, especially in postmenopausal, that is urethral stenosis, Due to estrogen deficiency, the urethra is stenosed and it contributes to incomplete bladder emptying and recurrent UTIs.
How do
Usually
you test for that?
we can take help of uroflowmetry. There is a specific machine which is uroflowmeter, and we can have a graph on it, and we can check what is the flow rate and how much is the residual urine. So if the flow rate is lower and the symptoms are like these, similar symptoms can be present in a female patient, that she has increased urinary frequency
Burning.
and nocturia, burning sensation, recurrent UTIs, and she has to wake up multiple times at night to void. Main reason behind is incomplete bladder emptying, and it is very much common, and we have, it is very simple procedure of urethral dilatation in female, which could be done in OPD based environment.
So one you said is the blockage, but are there any other reasons? For example, having a short urethra, they say there is a shortening, or then a lot of hygiene reasons. Does hygiene play a role in it?
Yeah, exactly. There are other factors also. One is this urethral stenosis. In the multiparous females who have delivered a lot of kids already, there is uterine prolapse. Sometimes uterus is prolapsing down from its normal level. It prolapses down and it is also compressing the urethra, which is also a contributory factor. And of course in the female it is short urethra, and they are more prone to catch the urinary tract infection from public toilets and hygienic reasons. So basically they should clean their perineal area from front to back, not from back to front. Because
even in small children, when they clean them or wipe them.
Exactly.
So when they say when somebody has UTI that they should take a lot of cranberry juice and they should make their, the pH of the urine should be, I don't know, acidic or alkaline. So they give them this citralka syrup and all. What is the role of this alkaline or acidic pH, number one? And do these cranberry juice and all of this help or not?
Yeah, definitely. So first of all, hydration is the most important thing to avoid the development of urinary tract infection as well as the stone disease. So well hydration means that patient should take at least 2.5 to 3 liters of fluid intake per day. Ideally, there should be 2.5 liter of urine output in a normal healthy person per 24 hours. Means if it is hot weather and summer season, patient might need to drink 3 to 4 liters of water or more. And if it is winter season, might be 2 to 3 liters is enough. And the thing is, well hydration is main thing. And this cranberry you asked about, it is definitely, they are probiotics. So minor UTI could be covered up with these probiotics, and they definitely optimize the pH of the urine, which helps in preventing the UTI, and they contribute even to the treatment of UTI up to some extent.
What about bladder issues? A lot of people have cystitis or some inflammation in the bladder and they have pain. So what are the reasons for this issues in the bladder, and how do you detect it?
So mainly it is urinary tract infection. A person will catch a urinary tract infection, and if it is not treated well in time, it would contribute to the development of cystitis, and in male patients even up to prostatitis. And
prevent these UTIs, and especially if they start affecting the bladder also and cause cystitis and all of that. So how do we prevent it? You were talking about probiotics and their role as well.
Yeah, exactly. So first of all, good hydration is very important. A person should be taking enough fluid intake and mainly water, so that he is able to pass about 2.5 liters of urine per day. So this is a major preventive factor. And the other thing is use of probiotics. They definitely help in avoiding and treating urinary tract infection. And the other thing is, if there is any other cause, like if there is any bladder stone or stone in any other part of the urinary tract, it should be removed.
So when we talk about stones are a very common concern in our society, whether they are stones in the kidney or the ureter or the bladder. So what are the different kind of stones? What are the causes of these stones, and how do we get them treated?
So we can divide the stones according to their composition and according to their location and according to their size. So mainly there are different types of stones. Most common out of those is calcium oxalate stone, which
Okay.
contributes about 60 to 70%.
Okay.
Then there are uric acid stones, calcium phosphate stones, and cysteine, and sometimes drug related stones are
Okay.
present in the body. So if they are present in the kidney, we call it as renal calculus. If they travel down into the ureter, they are known as ureteric stones. And if they are present in the bladder, we call it as vesical calculus.
Okay.
So according to the location, according to the size of the stone, there are different treatment modalities.
Okay.
Like if it is present in the kidney, we are doing
Lithotripsy.
lithotripsy is a good option for small size stones.
Okay.
But if the size of stone is bigger, more than 2 centimeter, there is a surgery called PCNL, percutaneous
Okay.
nephrolithotomy.
Okay.
We make a small keyhole in the kidney, enter the kidney with the help of camera, break the stone with the help of our mechanical device or laser, and then remove the fragments.
Okay.
Similarly, if the stone will travel down into the ureter, that is the most difficult thing for the patient, and it is an emergency situation. There is ureteric colic, and colic that is very much severe, might be associated with vomiting and
Right.
hematuria or urinary symptoms. So that is basically an emergency. We
Okay.
scan the patient with the help of CT scan. If stone size is smaller, less than 5 mm, usually we treat it with the help of medications.
Okay.
And we hope that it will pass out without any surgery. But if it is of larger size, we have different treatment options, which is URS, ureterorhinoscope. There is a camera.
Okay.
With the help of that, we reach into the ureter, see the stone, break it with the help of our mechanical devices or laser, remove the fragments and put a stent.
So these stones, how do you detect them? What are the investigations that a person needs to go for if he's facing like pain going to the back, and problem in urination and blood in the urine, or any of these symptoms? So what tests should they go through so that they know that, okay, we have stones and we need to get operated for them?
Yeah, exactly. If patient presents with the symptoms of ureteric colic or renal colic, after optimizing the condition and making the patient pain free, we send them for imaging. It could be ultrasound, KUB, or it could be CT scan. So usually we start with the help of ultrasound. If it will show us stone in the kidney or hydronephrosis means that there is a pressure inside the kidney, means there is some blockage distally in the ureter. So we suspect that there is a stone. And if ultrasound is not able to show a stone in the ureter, sometime it can, sometime because of bowel gases it is not helpful. But if there is hydronephrosis, we should send the patient for CT scan. CT scan is the ideal modality or the investigation for ureteric stones. So we should do CT scan if there is ureteric stone. According to its size and location, we have different treatment plans.
Okay. Now, what about strictures? What are strictures in the ureter or at any place? What and how are they caused?
Okay. Stricture is basically a narrowing in the normal lumen. So stricture could be present at the level of pelvic-ureteric junction, which is the pelvis of the kidney and beginning of ureter. It could be at any level in the ureter, and it could be present in the urethra.
So what are the causes of these stone formation? Is it some kind of diet, some kind of drinks that we take, or a lot of drug abuse, or what is
Yeah.
it? And how do we avoid formation of stones? And what is the ideal diet for a kidney patient?
Exactly, this is very good question. So mainly the stone formation could be avoided with the help of multiple factors. Most important of them is fluid intake. As I mentioned previously, there should be ideal fluid intake 3 to 4 liters per day. With the help of good fluid intake, we can reduce the incidence of stone formation. And another thing is salt intake. Excessive salt intake, it contributes to the stone formation, especially a sprinkled salt over the diet. We should avoid that and should try to minimize the salt intake. Other thing is protein diet. High protein diet is a big contributory factor in the stone formation. High protein diet means red meat,
Then a lot of people are taking these keto diets these days and getting kidney stones.
Yeah, exactly. It is also a harmful thing. So protein diet means that red meat should be avoided. It should not be completely stopped. Once per week is enough.
Okay.
They should take once per week, especially the other things like egg, yellow portion of egg. It should be avoided. Excessive cereal intake. These are all contributory factors to the
Okay.
high protein.
Okay.
And high protein diet is a contributory factor in stone formation.
Okay.
Other thing is usually these stones are combination stones of calcium and oxalate. So there are certain factors which are oxalate in the food. We should try to balance.
Like spinach and all of that.
Exactly, there is spinach, there is tomato, coffee,
Okay.
nuts,
Okay.
beans, and these are
And too many
chocolates.
calcium supplements and all
No,
of that.
calcium is basically, it is myth that calcium
Okay, it doesn't have
is
a role.
harmful in stone formation, or excessive milk intake it is harmful. Basically, we need to take calcium in the diet.
Okay.
Calcium is not harmful. It helps in reducing the incidence of stone.
So you said tomatoes and what else?
Oxalate diet includes these coffee beans,
Okay.
nuts,
Okay,
and
tomatoes.
chocolates, tomatoes, spinach.
All right.
These
Okay, so
should
this
be
should be
avoided, and they
Salt
should
also.
not be taken excessive amount.
Okay.
Salt is major contributory factor.
Okay.
Dehydration is a major contributory factor.
Okay.
So milk is not harmful. Rice is not harmful. These are myths.
That's it. You're talking about kidney disease, a lot of causes of hematuria where they say nephrotic syndrome, nephritic syndrome. What are these syndromes? What are the diseases of the kidney and what are their symptoms, and are there some congenital problems also or some problems develop later?
Yeah, exactly. These could be congenital and these could be acquired. Glomerulonephritis, it is the infection of the kidney, and usually we are not dealing, as a urologist, we are not dealing with the glomerulonephritis.
The
or
nephrologist deal with
Yeah,
that?
definitely. We have to refer, if it is a pediatric patient, we have to send them to pediatrician,
Okay.
and adult patient to a nephrologist.
Okay.
So they are mainly treated.
So basically, if the problem is inside the kidney, then you go to a nephrologist, and if it is in the urinary tract, from the urethra, urinary ureters, urinary bladder, it is with the urologist,
Yeah,
right?
rather we can say that if it is a surgical cause, then
Okay.
urologist is a proper
Okay.
doctor who will treat the patient. And if it is a medical cause, so nephrologist is a medical specialist who
they
is
will be
dealing
dealing
with glomerulonephritis
nephritis.
and syndromes.
And syndromes like nephritic and
Exactly.
nephrotic. So, okay, when we talk about RFT, renal function test, so can you kindly explain what does creatinine mean? What is this BUN? All these numbers. What do they exactly mean, and how should it be an ideal test?
Yeah. Actually, creatinine is a waste material, waste product of the body, which is meant to be excreted by kidneys and maintain at certain level in the body. But if kidneys are not working properly, or RFTs are deranged due to the reduced glomerular filtration rate of the kidney, then the serum creatinine level will start rising inside the body, which is a harmful waste product which is meant to be removed. If it is not being removed properly by the kidneys, and serum creatinine level is raised, and similarly urea is raised, blood urea nitrogen is disturbed, means the patient is going towards the renal failure. Kidneys are not working properly, and again we have to take help of a nephrologist.
So when we talk about renal failure, do you deal with kidney transplant?
Yeah, so renal failure, first of all, nephrologist would be a proper doctor who has diagnosed, and he is dealing with these cases if a patient needs dialysis or whatever. And then they involve a urologist. When the patient will decide, and his nephrologist would decide that transplant is a better option for that patient, then they would involve a urologist, and there would be a workup of the patient and donor. Donor should be ideally from his family, a close relative, so that a better tissue matching is done, and survival rate of that graft.
But a lot of patients have really benefited from transplant operations, right?
Exactly.
They have long lives, and they're supposed to take a lot of precautions after the operation.
Yeah, definitely, because it is only a solitary kidney. They are dependent on one kidney. They should be very much careful about their dietary intake. They should regularly follow up with the urologist and nephrologist. regular scans should be done, that if there is any development of stone or any other pathology in the kidney, it should be treated well in time instead of delayed treatment.
Okay, when we talk about cancers, what are the cancers that are common in these kidneys, adrenals, ureters, bladder, urethra? Are there any, like we spoke about prostate cancer, what are other cancers are common? How do you detect them? Does early detection actually save life? What are the surgical options?
Yeah, exactly. Carcinoma can develop in any part of the urinary tract. There is renal cell carcinoma, there is ureter carcinoma, there could be prostate cancer, bladder tumor, there could be urethral carcinoma, there could be penile cancer. Cancers are present in all the bodies.
What are the signs and symptoms of these cancers?
So usually the symptoms of the carcinoma patient is hematuria. In in the urological carcinomas, hematuria could be the first alarming sign with patient would present, and it could be painless hematuria. Mostly it is painless. If hematuria is present along with pain, we usually think about there could be a stone which is causing injury to the urinary tract, contributing to hematuria. But if it is painless hematuria, it is a red flag, and we should immediately scan and investigate about carcinoma. It could be renal cell carcinoma. Presenting symptoms or sign could be just hematuria.
Okay, only hematuria, no weight loss, loss of appetite, change in bowel, all of that.
These are
Generic,
these are ideal symptoms, but not always present.
Okay, not always
It
present.
could be only simple hematuria.
And what are the options of treatment for renal cell carcinoma?
Yeah, definitely it depends upon the size of the tumor and its stage and further investigations. Usually if it is smaller in size, we can do partial nephrectomy. We have to remove only the portion of kidney which is having that tumor. But if it is big size tumor, or if it is the location is like that, we cannot save the kidney, then it is radical nephrectomy, means removal of whole of the kidney along with its surrounding.
What about testicular tumors?
Yeah, testicular tumor is present usually in the middle-aged male, and
How does that present?
it presents with the lump in the testes, which could be painless again, and hard enlarged testes. A patient would present to a doctor, he will examine it. If he is suspecting that this could be a testicular tumor, then we take help of tumor markers. We can take help of ultrasound, and accordingly, if it is diagnosed as testicular carcinoma, we have to remove that testes and further managements.
And what about the causes of urinary incontinence in females as well? Because we spoke about urinary incontinence in males, but what are the reasons for urinary incontinence in female? Poor bladder control, loss of control, and how do you fix that?
Yeah, in the female patients, it could be urge incontinence, or it could be stress incontinence, or it could be mixed. Urge incontinence and could be because of overactive bladder. Sometimes the bladder becomes overactive because of certain irritants, because of climate and those factors. We have to find out the cause first. But in the female patients, mostly it is mixed, both urge as well as stress incontinence. Because of the stress, means it could be cough, it could be straining, weight lifting.
Multiparous.
Yeah, multiparous women. We talked previously, it could be prolapsed uterus from its normal location, it is prolapsing down. These all are contributory factors in compressing the urethra, and because of that leading to incomplete bladder emptying. Because of that, it could be urgency, it could be incontinence, and all these factors. And urethral stenosis, if it is urethral stenosis, simple urethral dilatation can help. If it is uterine prolapse and those things, we have to involve a gynecologist, and we have to fix the uterus to its
To Manchester
normal
repair
level.
and all of that.
And similarly.
All right. What about a lot of children who have this problem of bedwetting at night?
Yeah.
What is the main cause of this bedwetting, and how do you avoid this in young children? What is it? Is it psychological? Is it structural? And there are a lot of medicines also available for bedwetting. So what do you suggest?
Exactly. These all things contribute, which you are talking about. We called it as nocturnal enuresis. This is our medical term. That is incontinence, involuntary incontinence. That patient is sleeping, and during sleep he is not aware, and it leading to bedwetting. So mostly it is in the younger children and it improves with the age. You can say it is a psychological thing or because of too young age. Usually with the up to age of 5 years, this problem is resolved until and unless there is any other organic cause. So first of all, we take history from the patient and his parents, and we ask about them that was there any dry period in between or it is continuous since birth. And first of all, we give them behavioral management options that is better instead of starting directly with medications. Like fluid management at the evening, in the evening time, they should restrict the fluid intake. They should restrict the cold drinks, which are diuretics basically. Before going to bed, they should not take tea or excessive fluid intake. And you should reward the patient. Tell them, the children, that you will get reward in the morning. If you will be dry in the morning, you will get this gift or any reward.
And this tablet
usually
that
they
is very
improve.
common, Minerin or something, why? What is the mechanism involved in that?
Those are the last options. Those are the last options. If with the behavioral modification, patient will improve, that is well and good. If not, then we have to take help of these medications. These are basically antidiuretic hormones. They reduce the urine production at night. If we give them medicine, they are usually given before going to the bed, before sleeping.
But psychological help is far better.
Yeah, and sometimes antidepressants, they are also helpful in improving this condition.
All right, thank you so much, Dr. Saab. You gave us your precious time. I would like you to give one message to all our viewers regarding good urology health so that they know, and I'm really grateful for all your time and in-depth explanation.
Yeah, thank you very much. Message is that first of all, prevention is better than cure. So we have to avoid the diseases and stone formation and those things. So being a urologist, I would recommend that fluid intake is the most important thing in person's health. If he is taking enough fluid intake, which includes water, it could include tea and milk and any liquid. So enough amount of fluid should be taken. It could reduce the incidence of recurrent urinary tract infection, stone formation and other things. And if there are any symptoms related with age like benign prostatic hyperplasia, again you should consult urologist well in time, and usually medicines is helpful. Patients are afraid that they would not be managed with medicines and they always need a surgery. That is not a cause. They could be treated with medications as well. And similarly, the infertility patients, they should not be shy and they should consult a urologist and their problem will be resolved.
Thank you. Thank you so much, Dr. Farrukh, for joining us
I'm
today.
really honored.
Thank you so much for joining us today, and you heard it from Dr. Farrukh himself, the urologist, that it's very important to take care of your kidneys and your fertile health, and as a groom it is your responsibility to check yourself first before putting anything on your wife or your bride. Thank you so much for watching. Inshallah, we'll meet you next week. Allah Hafiz.